I am Charnat Hailu, Assistant Professor and Consultant Public Health Professional Specialist. Welcome. This presentation is on health research methods. The specific topic of today's presentation is selecting and setting a research topic. After attending this presentation, you should be able to describe the definition, major characteristics, and process of health research. Identify problem situations or topics requiring research. Describe criteria for prioritizing topics for research. Select and or set a research topic using the prioritization criteria. Now let us see some introduction to health research. What is research? Research is a systematic process of collecting, analyzing, and interpreting data in order to increase our understanding of the phenomenon about which we are concerned or interested, with the ultimate goal of solving a particular problem or answering question. Major characteristics of research. Research demands a clear statement of the problem. It requires clear objectives and a plan. It is not aimlessly looking for something in the hopes that you will come across a solution. It builds on existing data using both positive and negative findings. New data should be systematically collected and analyzed to answer the original research questions or objectives. Desired attributes of research. Timeliness. Research should be done timely to use its findings to solve the present problem. The other desired attributes of research is its dynamicity, meaning a solution obtained now may not work forever. So, identifying the changing problem and continuing further research is required to ensure continuous improvement of the health of the community or the setting. The other attributes of research is context related. Research should be done based on the context of the community, based on the research needs of the community or the setting. Reliability. A research should be reliable. The findings obtained using a research should be replicable when it is done by another researcher another time with the same condition and method. Unbiasedness. Research should be done in unbiased manner using scientifically sound methodologies as much as possible. It should be free of error. It should be unbiased. Purpose of research. The main purpose of research is to create knowledge essential for action. Without good knowledge, interventions would have neither logical nor empirical basis and are destined to fail. The three general purposes of research are exploration, description, and explanation. It should be noted that one or more of these purposes can be applied on a single study. Exploratory research, usually conducted when relatively little is known about the phenomenon under study. The subject of study is relatively new and unstudied in the past. The researcher in exploratory study explores the topic in order to become familiar with it and to gain ideas and knowledge about it. Descriptive research. It is conducted to numerically describe some current or past phenomena, to answer questions such as what is the success rate for a particular treatment or program? What is the prevalence of obesity in adult people of a particular town? Descriptive studies summarize the characteristics of particular individuals, groups, organizations, communities, events, or situations as completely, precisely, and accurately as possible. Also, it helps to formulate conceptual hypotheses. Explanatory or analytic or comparative research. It seeks to explain the reasons behind a particular occurrence of an event or outcome or problem by discovering causal relationships. It answers questions of why and what will be the effect. It can be the effect of intervention or policy and so on. Example: what factors might account for the high dropout rate of a particular immunization program? This is a good example of a research question which can be addressed by explanatory research. What's health research? Health research is a research designed to address health and health-related problems and come up with better solutions to mitigate the prevailing problem. Different types of health research vary in their focus and role in overall health development. So now let's see classification of health research based on the application of biological, social, and behavioral science methods. The objects of analysis used in this classification are the level of analysis, health problems or conditions, and healthcare responses. By level of analysis, health research it can be done or analyzed at individual and sub-individual level or at a population level, for example, in population health research. By health problems or conditions, health research can be biomedical research or epidemiological research. Biomedical research mainly focuses on studying biological processes, body structure, function, and pathological mechanisms at individual or sub-individual level. Whereas epidemiological research, it studies the frequency, distribution, and cause of disease and its application in the prevention and control of disease. By healthcare responses, health research can be clinical research or health systems research. That is by considering the healthcare responses to the health problems or conditions occurring in the population or in the community. Clinical research deals or studies about the efficacy of preventive, diagnostic, and therapeutic processes, example, drug efficacy and side effects. And also, it studies the natural history of diseases. Health systems research can be policy research or operational research. Policy research, it studies the determinants, design, implementation, and consequences of health policies. Whereas operational research, it examines the resources and process used by the health services and the outputs they attain. Research process and its main steps. Research is a process and it is a continuous process, it is a dynamic process. The circle here, as you can see from this figure, it indicates that research is a dynamic process. It begins from identifying research idea, identifying and defining research topic or problem. And of course, that should be based on research gap or research need identified from reviewing literatures. After reviewing previous studies adequately based on the research gap identified from the review, research questions should be developed, and then of course objective and hypothesis of the study should be well stated. Then design the study and methods, secure ethical approval, pre-test and pilot study and data collection of the actual study should be done. Data processing and analysis should be done. And then interpretation of results, including comparison to other previous researches should be done or discussion should be made. And of course, drawing conclusions and recommendations based on the findings of the study should be made, and then dissemination of the findings to relevant stakeholders who are concerned to the improvement of or who are working to improve the health of the population or who are responsible for the setting. Then of course, new problem or new research idea should be generated, and then it can be the research process can be continued. So research is a dynamic process which includes these steps. So now let's first see the first step in the research process. That's identifying research idea or selecting and setting a research topic. As we have seen earlier, research is the systematic collection, analysis, and interpretation of data to answer a certain question or solve a problem. So the motivating force in every research is the existence of a problem and the interest to solve that problem or to answer the question. So the research idea is or the topic is based on this problem, which requires answer or solution in the community or in our setting. How to generate topic or problem for research? The source of research ideas or problems can be experience, meaning observation of problems in the workplace, environment, or community. And reading or reviewing literatures. Need for further research is also indicated in the report of previous researches or articles, books, conference proceedings, etc. And the other source of research idea is talking to people, talking to health workers, community representatives, managers, and policymakers at various levels. From the various sources, we may have identified many research ideas, but all may not require research. So we have to check whether really each research idea requires research or not. Whether a problem situation requires research depends on three conditions. 1. There should be a perceived difference or discrepancy between what exists and the ideal or planned situation. Second, the reason or reasons for this difference should be unclear so that it makes sense to develop research questions. And third, there should be more than one possible answers to a research to the question or solutions to the problem. Example problem situation. Let's say District X of Ethiopia has a total population of 50,000. In the district, there are 2 health centers, 1 hospital, and 15 health posts, and all of them have been functioning smoothly in the past 1 year. However, at the end of the year, it was found that the EPI coverage in children and mothers for all vaccines was below 25%. Does the problem situation in the district require research? So to answer this question, we have to consider the 3 conditions which we saw in the previous slide. So based on the 3 conditions, the discrepancy observed in the example situation is, although District X has 100% availability of health services and at least 80% of the children and mothers were expected to be fully vaccinated, the EPI coverage was less than 25%. The problem or question which can be generated from this discrepancy, the discrepancy observed from the given situation, is that why low coverage? Why the coverage is lower than 80%, the recommended target? Why low coverage? What are the factors influencing the EPI coverage in District X? The possible reasons or answers could be: mothers might have had problems for not attending in the EPI sessions, or the EPI programs might haven't been integrated with other MSA services. Hence, children might have missed opportunities in getting vaccinated. Or the follow-up of defaulting children might haven't been effective, and other reasons. So the possible reasons or answers for the question are more than one. Thus, the above problem situation requires research. Framing a topic. Once we have identified research ideas or problems which requires research, then we should frame each research idea to a research topic. A research topic should be concise, clear, measurable, researchable, and informative of mostly what, who, where, and how to study, or the study design requires to address that research topic. Currently, PCOTS form either as positive statement or question form is recommended. PCOTS is an acronym. P is for population or patient and problem. I is for intervention or exposure. C is for comparison or control. O for outcome or result. T for time frame or follow-up duration required for the study. S for study design or study setting. Usually, 2 or 3 of the PCOTS components are included in a research topic or question. Let's see examples of research topics. Determinants of stunting among children aged 6 to 59 months at Kindo Didaye district, Walaita zone, southern Ethiopia, a case control study design. In this topic, Okay, determinants of stunting. This is the what of a research topic. Who also addressed that children aged 6 to 59 months, and where the study is done. It is also addressed, it has been addressed, that is the Kindo Didaya district, Walaita zone, southern Ethiopia. And how the study will be conducted, that is also addressed. That's case control study. The next example, it is in question 4. It says, what is the effect of obesity on incidence of hypertension in adult population of Nigeria? So, obesity, it is the I or E of the acronym, the PCOS acronym. Incidence of hypertension is the O of that acronym. Adult population, it is the P of that acronym. And Nigeria, it is the S or the setting. Among the various research ideas or topics we have generated, if we are sure or identified those which requires research, then among the many we have to select one for our research project, because we cannot solve or we cannot do research on all of the topics. So we have to identify one research topic. So to select and set a research topic, first we have to list the several research ideas or topics which have come to the mind of us, the researcher, and to the responsible persons for the health status of the community. Then, each research topic or research problem that is proposed for research has to be judged or compared to all other options using certain guidelines or criteria. The judgment or the evaluation of each research topic using guidelines or the criteria, okay, should be done by involving the responsible persons for the health status of the community. These responsible persons can be managers in the health services, healthcare workers, community leaders, as well as researcher or researchers. Now let us see about health research topics prioritization criteria. To select one research topic for our research project, we can use criteria. One of the criteria is relevance. By relevance, we mean the topic you choose should be a priority problem of the community or our setting. By taking into account how large or widespread is the problem, who is affected, how severe is the problem, and so on. By considering this criterion, a score of 1 can be given if not relevant, 2 if relevant, 3 if it is very relevant. The second criterion is duplication. By finding out whether the suggested topic has been investigated before, either within the proposed study area or in another area with similar conditions. If the topic has been researched, the results should be reviewed to explore whether major questions that deserve further investigation remain unanswered. That is, to make the research original or novel. By taking into account this criterion, a score of 1 can be given if sufficient information available already. 2, if some information available but major issues not covered. 3. No sound information available on which to base problem solving. Urgency of data needed or timeliness is the third criterion. That is referring to the urgency of the data needed on the topic. One score can be given if information not urgently needed on the topic. A score of 2 can be given if information could be used right away, but a delay of some months would be acceptable. A score of 3 can be given if data very urgently needed for decision making. The fourth criterion is political acceptability of study. Acceptability by the policy or local or national authorities will increase the chance that the results of the study will be implemented. But a study may be required to show that the government's policy needs adjustment. If so, you should make an extra effort to involve the policymakers concerned at an early stage in order to limit the chances for confrontation later. By considering this criterion, a score of 1 can be given if the topic not acceptable to high level policymakers or it is not consistent to the policy of the health policy of the country. A score of 2 can be given if the topic more or less acceptable. 3 if the topic is fully acceptable. The fifth criterion is feasibility of the study. By considering the complexity of the problem and the availability of resources which are required to carry out the study. When we say availability of resources, that means availability of financial or time or technology or expertise to undertake the study. So by taking into account this criterion, a score of 1 can be given if not feasible, 2 if feasible, 3 if very feasible. The sixth criterion is applicability of possible results or recommendations. Is it likely that the possible recommendations from the study will be applied? By taking into account this criterion, a score of 1 can be given if there is no chance, 2 if there is some chance, 3 if there is good chance for implementation of recommendations expected from the study. The seventh criterion is ethical acceptability. Review the proposed study for important ethical principles or issues such as the possibility of benefiting or harming the health of the study subjects and or others while carrying out the research, cultural acceptability, and possibility of obtaining informed consent. Will the condition of the subjects be taken into account? For example, if individuals are identified during the study as a result of or in the process of doing the study who require treatment, will this treatment be given? What if such treatment interferes with your study research? So by taking into account ethical acceptability of the topic, a score of 1 can be given if major ethical problems, 2 if minor ethical problems, and 3 if no ethical problems related to the topic. Okay, finally, I recommend you to practice yourself, preferably by forming a team. Identify 3 research topics, prioritize them, and select and or set one of them for your research proposal development exercise. Use the following rating sheet. Propose at least 3 topics and evaluate each topic using the criteria which you have seen earlier, the 7 criteria. So for each problem, you can obtain a total score out of 21. Then you have to put, based on this score, you have to put the problems in descending order, in rank order. Then select the problem which has scored top for your study. Then you can do the full-fledged or develop the full-fledged proposal for the selected research topic. These are references which you can use to read further on selecting and setting research topic. Thank you for attending today's presentation. If you have questions, please write it in the comment box. Then I will respond for you. If you want to obtain consultation service for your research project in the future, please send your request to me using the email meet4chmphc@gmail.com. Finally, please like and subscribe the channel to get new presentation time.